Imagine a future where breast cancer treatment is precisely tailored to your specific cancer, avoiding unnecessary and potentially harmful therapies. That future may be closer than you think, thanks to groundbreaking research focused on capturing and analyzing cancer cells directly from a patient's blood. This could revolutionize how we treat early-stage breast cancer, but there are still challenges to overcome. Currently, around 25% of the 2.3 million women diagnosed with breast cancer each year are identified at an early stage known as ductal carcinoma in situ at DCIS, where the cancer hasn't spread beyond the milk ducts. The good news is that the prognosis for these patients is generally favorable. However, the concerning part is that, if left untreated, DCIS can progress into invasive cancer in anywhere from 10% to a whopping 53% of cases. These high stakes, coupled with the lack of a reliable way to predict which individual cases will become invasive, lead clinicians to recommend treatment for all women diagnosed with DCIS. This treatment often involves a lumpectomy, surgical removal of the tumor, or even a mastectomy, removal of the entire breast. Following a lumpectomy, radiation therapy is typically recommended. Furthermore, patients with hormone receptor-positive DCIS, meaning the cancer cells are stimulated by hormones, may also receive anti-hormonal therapy. But here's where it gets controversial. Are we overtreating many women with DCIS? As Sunitha Nagrath, a professor of chemical engineering at the University of Michigan, and one of the lead authors of a study published in Science Advances, points out, since early detection can save lives, physicians are now recommending mammograms at younger ages. So more young women have to make some life-altering choices. Early detection is vital, however, the current approach often leaves women facing difficult decisions about aggressive treatments, without truly understanding their individual risk levels. Nagrath emphasizes that patients are often presented with treatment options, without adequate information regarding which choice may be most effective based on their individual risk factors. This means some patients may undergo aggressive treatments, like radiation and hormone therapy, even if their cancer would never have spread. Conversely, others might receive treatment that isn't aggressive enough, leading to a recurrence. Statistics show that cancer reappears within 10 years in approximately 10% of cases treated with surgery alone. The ultimate goal, according to Fariba Bebed, professor of pathology and laboratory medicine at the University of Kansas Medical Center and another co-corresponding author of the study, is to identify biomarkers that distinguish patients who would benefit from aggressive interventions from those who may require only surgery or could safely forego treatment. The key to this personalized approach may lie in identifying and analyzing cancer cells circulating in a patient's blood. These cells, shed from the original tumor, can be present in extremely low concentrations, often below the detection threshold of standard lab techniques. The real danger is that these circulating cancer cells have the potential to seed new tumors in other parts of the body. To overcome the challenge of finding these elusive cells, Nagrath and Max Witcher, professor of oncology and internal medicine at the Medical School, developed a groundbreaking device called the labyrinth chip back in 2017. This ingenious device works by passing a blood sample through a maze-like network of microchannels. The unique design of the channels allows larger cells, such as cancer cells and white blood cells, to be separated from the smaller red blood cells and other blood components. By processing just a few milliliters of blood, researchers can isolate a sufficient number of cancer cells for detailed diagnostic testing. In their latest study, the researchers used the labyrinth chip to capture cancer cells from the blood of 34 patients with DCIS at the University of Kansas Medical Center. They then analyzed the activity of genes within individual cancer cells, both those circulating in the blood and those collected directly from breast tissue biopsies. And this is the part most people miss. The researchers discovered that the cancer cells from the tissue biopsies could be classified into 4 distinct subtypes based on their gene activity. Remarkably, Two of these subtypes were also found in the circulating cancer cells in the blood at significant levels. These specific subtypes exhibited active genes associated with disease progression, resistance to chemotherapy, and even platelet binding. Some research suggests that platelet binding might be a sneaky tactic used by cancer cells to evade the immune system. Other active genes seem to help the cancer cells avoid detection by immune cells. Neha Nagpal, a doctoral student in chemical engineering at the University of Michigan and the study's first author, explains that this information helps them narrow down what could have been indicative that these cells would circulate. Interestingly, the study also revealed a potential disparity among different racial groups. The 6 Black patients who participated in the study tended to have a higher number of cancer cells in their blood compared to white patients, along with increased signs of immune suppression. This observation aligns with the known higher breast cancer mortality rates among Black women. However, it's crucial to remember that race itself is not a biologically meaningful designation. The disproportionate cancer signatures are more likely linked to environmental factors and socioeconomic disparities that impact access to healthcare and exposure to risk factors. Looking ahead, the researchers plan to investigate which specific cell types and biomarkers are most likely to successfully travel to and establish themselves at secondary sites in the body. To gather this crucial data, they are transplanting cancer cells from their patients into mice. After a period of 4 months, the mice develop elevated levels of cancer cells in their blood, which the researchers then collect and analyze using gene sequencing. They also plan to meticulously track the disease progression in both the mice and the human patients to gain a comprehensive understanding of cancer behavior. This research was made possible through funding from several organizations, including the Forbes Institute for Cancer Discovery, Kansas University Cancer Center, Kansas Institute for Precision Medicine, and the National Center for Advancing Translational Sciences' Clinical and Translational Science Awards program. The labyrinth chip itself was developed at the Lurie Nanofabrication Facility. A University of Michigan startup called BloodsCan Biotech, launched with assistance from innovation partnerships, has licensed the labyrinth chip technology. It's worth noting that Sunitha Nagrath and the University of Michigan have a financial interest in BloodsCan Biotech, which is something to consider when evaluating the potential impact of this research. Nagrath also holds other positions at the University of Michigan, including Professor of Biomedical Engineering, Co-Director of Liquid Biopsy Shared Resources for Rogel Cancer Center, and member of the Biointerfaces Institute. This research opens exciting possibilities for personalized breast cancer treatment, but it also raises important questions. Could we be on the verge of dramatically reducing the number of women subjected to unnecessary and potentially harmful treatments? Will this technology ultimately lead to improved outcomes and reduced mortality rates for all women with breast cancer, regardless of their background? What are your thoughts on the ethical considerations of personalized medicine and the potential for disparities in access to these advanced technologies? Share your opinions in the comments below.